All right, guys, we are going to be talking about why Destiny is being very silly, just very dumb in general, and we're going to break down what he says about the jab and whatever, okay?
We'll take a vaccine.
And
Can't do it.
we'll
Nobody wants to do
see
it. Nobody
how
believes
he's
in
wrong.
medicine anymore. Like I'm seeing articles that there are like counties in Texas where ICUs are filling up. I don't know if there are any big cities yet where that's happening, but it's getting bad out there. We're getting 20, 30-year-olds intubated in ICUs at the moment. Yeah, it's pretty crazy. Some people apparently are there were like 75 nurses and doctors that walked out or something. I would be so pissed if I was a doctor and I had here is one thing that I think should happen. This is the most medically fucked opinion I have. I think it's defensible. Normally, unfortunately, for a lot of philosophical reasons, you can't really say, if you don't do this, then you're not entitled to medical treatment. Like, if you don't get the vaccine, because the problem is, like, you can run that argument back, like, a million ways, right? Like, if you go skydiving, should you be allowed to take up a hospital bed? If you're obese, should you be allowed to go, to an ICU if you have a heart attack, et cetera, et cetera? I think that if an ICU bed is full, if all of the beds are full and somebody new comes in, I think if you're unvaccinated, they should kick you the fuck out. I think that is where, because now you're in an area where you basically are, I think it's called medical triage, right?
Okay, so that's the first point he makes, right? That, oh, if you're in a position where you can get the vaccine and you don't, then you should be thrown out if nobody's, like willing to treat you or something along those lines. And my main disagreement comes in this way. Virtually anybody that is looking at any hospital in the country knows that they're not full. And he starts off by saying, well, this guy commented, and oh wow, there's 20-year-old, 30-year-olds in the ICU incubated. Like, first of all, not really, and second of all, how much do they weigh? And if the number starts with a 2 or 3, then that's the fucking issue right here, usually. So get real with this, okay, first of all. And then second of all, he's saying, well, should we reject treatment for fat people? Should we reject treatment for obese people, diabetic people? Look, here's the thing. First of all, the whole point is the emergency room and so forth is for people in general, okay? So we've already made an agreement as of the 1990s that, okay, if you're an illegal and you have your foot chopped off, we're going to help you and then deport you, right? But we have to help you. So this whole like, oh boy, if you're unvaccinated, we won't help you. I mean, that is kind of malicious, and so much for, oh, I give a shit about your health, but I guess if you don't want to help yourself, then go die. I mean, really. So yeah, being honest, mask off moment there. And insofar as, okay, we're going to kick you out if it's full, I mean, who cares? See, this is an oxymoron because this will never happen. Okay, there's not going to be a mass event where all the ICU beds are taken in multiple cities across the country. That is ridiculous. So you're saying, oh, but so-and-so hospitals are full in these small towns in Texas. I mean, like, really? How many hospital beds are in a suburb of Odessa, Texas? Okay, in any given in any given small town, yeah, sure. Is there a hospital? Yes. With how many beds? Like 2. So come on, get the fuck real about this. Okay, so I'm gonna let him hang himself with the rest. Hold on.
Right? Triage is where you're trying to figure out, like, who can we save because we don't have the resources to save everyone. I think if we're doing medical triage, then it's time to start picking and choosing. And if you're unvaccinated, listen, man, God took care of you so far. You go out to the parking lot, he can take care of you there. Like, I think that's what you have to do. Virologists have been saying that COVID will become an endemic disease for 6 months, but no one seems to want to admit it. First of all, I don't know if you don't want to admit it, but the problem is because we're not going to get up to the vaccination rates that we need to. We have all the tools to do it. We just aren't willing to do it. Like,
see, that's facetious. Oh, there's going to be an endemic, or specifically, a sort of, the pandemic is going to go on another 6 months because we haven't gotten herd immunity, which is ridiculous. Because, okay, so the Pfizer vaccine, which was for months was said as being the best vaccine, right? Oh, don't get the Johnson one. Oh, don't get AstraZeneca. Get the Pfizer one. This is the best one. And guess what? The efficacy rate, according to the New York Times, I believe, or the Washington Journal, whatever it is, they basically said that the efficiency rate as of a couple weeks ago in August was, I think, 42%, okay, effectiveness against the Delta variant, which is the one that's relevant right now, not the old one. So the Alpha variant, who knows? But in general, they promoted the vaccine as, oh, 95% effective, 100% effective, whatever have you. And now they're actually admitting that the efficiency is 42% as of last month, and it's probably under 40 at this point. So that's why they're bringing up the bullshit of the booster vaccines. So that's the point. So when you say, oh, well, if we're at 60% vaccination, but we need to get to 80%. Okay, like, what difference does that make? Think about it this way. The difference between 60 and 80% vaccination, and if you're looking at the efficiency of the vaccine at, let's say, a median or average percentage of 50% prevention of spreads and deaths, then you're looking at a case of a 10% difference, okay? So 20% people have like a 50% reduction in their death possibilities. So in that case, we're looking at reducing the current increase in cases and all that by about 10%. So right now, oh shit, it's a pandemic, we're all scared of the virus, but if it goes down 10% and we all get our way by getting these shitty vaccines, it'll fix it, really? So what, 10%? Is that really good? Like, okay, 600,000 people have died, but if it was 555,000, that'd be okay, that'd be tolerable. Like, shut the fuck up. Both are fine. Those are acceptable numbers for death. Keep in mind, for every person that has died of the corona, allegedly, assuming the government's not lying about the numbers of the deaths, we are looking at maybe 4 or 5 transvestites, transformers that exist. So for every COVID person, there's like 5 Caitlyn Jenners. Okay, so to say like, oh, it's a lot of people dying, yeah, shut the fuck up. Not really.
Kind of do this loosely with organ transplant lists. Oh yeah, for sure. Yeah. What's the vaccine rates for adults in the U.S.? Are we starting to get to 60%? Maybe, I think. Way back in January or whatever, I thought it was stupid the U.S. government didn't just give $1,000 stimulus to everyone who took the vaccine. Yeah, maybe they needed to do that. Yeah. I mean, it's like America. I mean, just look around at Americans. They don't want to take care of themselves, so why the fuck would you expect them to? It's such a no-brainer for me, especially somebody that travels.
Again, so, yeah, maybe we should have given people $1,000 that we don't have to for them to get vaccinated, and it's like, well, how is that even justifiable, right? Okay, so we're gonna give you 1,000 and ignore the 136% debt to GDP ratio we have, right? It's like saying, okay, you make 10 grand a month and you owe and you basically have a $15,000 debt on your credit card. Hey, maybe we should have given your son $1,000 to start a gym membership. Like, first of all, we can't afford that, and second of all, insofar as efficacy of that, I don't think it'd be that effective. And then he's like, well, who cares? And Americans don't even care about themselves anyway. They're not going to take care of themselves, right? We're all fat. And it's like, well, okay, first of all, if there's this obesity problem and you already can see that we're having more cardiovascular problems health-wise, and that's more important than the coronavirus insofar as numbers go, then why aren't you making mandates on, okay, your BMI shouldn't be over 35, okay, you should not be over 100 pounds overweight, very reasonable stuff, and say, okay, we're going to ban that. But no, they're going to say, you have to put the fucking mask on, and we're going to vaccinate you to stop a virus that has a lethality rate of less than 1% right now, in general, versus saying, well, okay, we're going to mandate you working out half an hour a day, which would, technically save more lives through prevention of heart attacks and strokes than would vaccinating literally everybody on the planet, or, in America specifically. So again, the guy doesn't really think these things through, or just simply is too hypocritical to notice.
I always felt like vaccines were like one of the most important medical things. It's like one of the most superhuman things that we have. Like, vaccines are literally like going to the gym for your immune system. Why would you not? Why wouldn't you? It's like such a no-brainer. It's actually such a no-brainer.
The only way that he could think that, and first of all, why does he look like Ted Cruz right now? That's sad. Anyways, okay, so he's saying, well, it's a no-brainer. The vaccines help you. That's assuming there's zero risk. Yeah, of course. If there's literally no risk at all to getting the vaccine forever, if you told me, okay, you can reduce the chances of getting sick by like 40, 50%, and there's no strings attached, we're not forcing you, they're not going to force something later, there's literally no side effects, there's only the upside of less likely of getting sick. Sure, fine, fuck it, why not? But that's not the case. We're talking about something that is mRNA technology, that is, or, that sort of science has only been studied since 2007, which means that they could maybe, at best, promise, okay, you're not going to get any side effects for the next 15 years. But then they're saying, well, you're going to be fine, okay, in the year 2085, when you're 82 years old, Lalo, you're not going to get any side effects from the vaccine or the booster shots or anything like that. And to them, I say, fuck you. You don't know that because it's only been 15 years. So for you to just say that is ridiculous. And even if you were to say, okay, well, it's been 14, 15 years in the making. It's like, okay, well, first of all, how many people have been sampled as to getting it, from 2007 onwards? Probably a couple thousand in that specific early era, pre-2010. So again, not solid. And so for the millions of people that got vaccinated with this mRNA technology, only as of the last year, I mean, seriously, you're going to tell me that you can tell what the long-term effects are by less than a year of people getting it? No. So come on. These liberals are already supposing that there's no risk at all, okay? It's like basically saying, I'm an atheist and there's 0% chance there's a God. That changes it from saying, well, I'm an atheist, but I don't know because I'm not dead yet. I don't know if there's heaven. So again, this guy is just completely just assuming the government's right, which it's been proven so many times that they lie. So again, this guy is so neoliberal. He is so brainwashed, and he just takes it too. It's hilarious.
Yeah, true. Actually, it's easier than going to the gym because you don't have to actually do any work. Yeah, true. So I keep seeing this. Do you mean by superhuman, you mean 60% effective, and that's even vaccinated people get affected regularly? You can still get infected if you have a vaccine, but one, my understanding is that the worst case scenario trials that came out of Israel, or not trials, the data came out of Israel shows you have a 50% chance of getting infected versus normal people. Why do you think that's some kind of own? Fabian Sam, I don't understand. Like, you're looking at the person next to you, it's like, you've only got half the chance of dying as I do. Do you think you're safer? Like, yeah, you fucking moron. Like, what the fuck is wrong with you? Like, who else is borrowing? Like it's like you have 10 brain shit cells that you share between you and like 10 other conservatives. Like, well, of course. Like, not to mention, is the likelihood of being infected lower? Which it is, okay? Not an own dune. I'm saying it's losing issues. It's not losing issues. One, your likelihood of getting infected is half. And two, the actual severity of your disease is greatly reduced. And three, because the severity is reduced, because your immune system responds faster, you have a lower likelihood of spreading it because you don't have the same viral load. Like, people are like, it's not 100%, I'm not gonna take it. Like, you sound like my dumb fucking grandma.
Okay, first of all, wait. So he's saying, oh, it's such a own, right? Oh, it's not fully effective, bro. It's like, that's not what people are saying. Yeah, some stupid Republicans are saying that, but overall, that's not the argument. The argument isn't, oh, it only helps you a little bit, that's why I'm not taking it. They're saying, you promised us it would work, and it's not, first of all. And second of all, even if it was working, there are side effects that people aren't talking about, okay? So again, you are being so disingenuous, okay? This guy's such a prick, because look at it this way. So he's automatically assuming, okay, there's no long-term side effects, which nobody can prove. It is factually incorrect to say there will be no side effects in 50 years from this, because nobody has gotten mRNA stuff for 50 years, you know, in this capacity. So again, just completely disingenuous. And then second of all, to say, oh, well, you know, you're making fun of me because the vaccine only works 50% of the time, but for you it works 0% of the time. It's like, well, first of all, the odds that we're talking about getting the corona is not even that high, okay? So if the contagion rate is like 10% up, you know, in a given population in America, 10% of people will get sick over a year. You're saying, well, I have a 5% chance, so go fuck yourself. It's like, no, who cares? What's the big deal here? Obviously, the people that are afraid of the vaccine don't really care that much about the virus, because if they did, they'd be hiding like a pussy, like Destiny, in his house all day, put the mask on when he goes out, okay, like a coward. So it doesn't make sense at all to say, oh, I will, you know, inoculate myself, risk getting long-term effects for something that only has like a 0.5% chance of killing me, which is what Destiny's doing. And to say like, oh, you're just like my grandma, like, shut the fuck up, really? So maybe his grandma had a part in him being raised to be a retard. But anyways, I'll let him keep going.
They wouldn't wear her seatbelt because she was like, well, one time I saw a story in Shannon. She got locked in her car and she burned to death because she had her seatbelt on. Like, the reason I go back to my seatbelt example is because my grandma used to say that over and over again. I was like, grandma, you're so fucking stupid. Like, holy shit.
They're going to restaurants, even when the efficacy of this vaccine is questionable at best. We see that in Israel, an 85% vaccinated country that's about to lock down again. And most of the new cases are from vaccinated patients, not unvaccinated patients in Israel. So, sorry, I'm interjecting, but obviously against mandates, and I think people should make their own medical decisions. I think it's pretty obvious.
Well, I disagree. I think we actually have a story on ranting.com that our view of the lockdowns is that it's alarmism because a new study from the Public Health of England found the Pfizer vaccine is 96% effective after 2 doses at staving off the Delta variant, and AstraZeneca was 92%.
I could probably agree it's alarmism, but it's enough of an alarm for public health leaders to undermine the argument that the vaccine is a solution to what would possibly satisfy the public. I mean, I was against the lockdowns in the first place. Let me be very clear. When there was 1,000 deaths today, not 334. Sorry.
If we today were trying to make it so that every car had seatbelts, we wouldn't be able to do it. These motherfuckers wouldn't let it pass. I knew somebody that had a seatbelt on and they died because they were locked in their car and it caught on fire after a crash. I knew somebody that had a seatbelt, they got in a crash and they still died anyway. It's not effective. I knew 10 people that got in car accidents, none of them were seatbelts, they got out just fine. Like, dog, there are 330 million people over in the United States. You can find.
Okay, so again, disingenuous. This is the only way these people can argue the points without losing every time. They have to lie. They're saying, oh, you saying that the vaccine isn't worth it is like if before we developed seatbelts, you just went against them because some people died as a consequence of using the seatbelt. That is so ridiculous because there is no long-term effects from using a seatbelt that's appreciable. Okay, if you put something on yourself that is, you know, made out of fabric or whatever, you know, the seatbelt with a little bit of metal on it, I mean, that is not going to kill you. That is not going to give you, it's not going to thin your blood. It isn't going to give you cortisol increases. It's not going to give you a bunch of shit like a spike protein mRNA vaccine could hypothetically do. So again, very disingenuous. Nobody's saying the seatbelts have a long-term effect other than maybe they're uncomfortable. So if anything, the analogy would be the mask is like the seatbelt, just that the mask doesn't do anything and the seatbelt does help you if you do get in a car crash. And even then, that's on the possibility you get in a car crash. Okay, that's, I mean, come on, this is simple stuff. So again, the only way he's arguing out, you know, a victory, so-called, the only way these people kiss his ass in the chat on Twitch and on YouTube is if he personally says, you know what, this is just like seatbelts, but it isn't. Seatbelts have no long-term consequence to your health. It doesn't alter your DNA or manipulate it in some sense or make it develop a virus to fight a virus that isn't even a big deal to begin with. Okay, so again, very disingenuous, bro. Seatbelts are nothing like the fucking vaccine, bro. If it was, then I'd probably get a vaccine, but it isn't the case, okay? There is a good chance that there will be some sort of side effect for a good portion of the people who do get the vaccine, whereas there is zero chance that somebody's going to be like, oh, fuck, I regret getting a seatbelt. I regret using a seatbelt. Like, really? Come on. Again, come on. This is so silly, bro.
Brought a stupid fucking story for literally anything. I mean, fuck, you have a fan base. Destiny was the one claiming that everybody vaccinating would end the virus. He lied. Wrong! What I said was the more people that get vaccinated, the higher the chance you get to herd immunity. The vaccine does not need to be 100% effective to get rid of the virus. The vaccine only needs to reach a certain threshold of effectiveness for things like masking and social distancing to kick in so that, okay, well, now it's not a problem anymore. The vaccine does not need to be 100% effective to eliminate the virus. I don't know what it needs to be. I think it depends on the measures. Like, I think if it's like 70 to 80% effective, then that plus masks can theoretically eliminate it. Or if it's like 90%, then that plus just social distancing eliminate it. The vaccine doesn't need to be 100% effective to get rid of it. I can't believe I'm arguing this. It is actually so fucking depressing to me that I have to argue this. I'm so glad that I'm rich, so I don't have to be in your horrible communities where you guys are crawling around killing each other for fucking food and medicine because you were too fucking stupid to get vaccinated. So I don't care about these problems, okay?
Okay, the elitist fucking sentiment here is so patronizing, and he isn't even self-aware about it either, so it's like, come on. He's over here saying, well, you know, technically, you poor fucks are fighting and killing each other over medicine. Nobody's doing that. Shut the fuck up. You guys are just killing each other just to get into the ICU. This is so bad. Get to the chopper. No, it isn't. Nobody's bitching about it. The people that are complaining about the vaccine aren't complaining about the virus in general. They're complaining about the government overstepping, you imbecile. Okay? Jeez. It's basically like saying, okay, imagine if we had a mosquito problem in a house, right? And somebody went around with a flamethrower, and then the person complaining, hey, you're going to burn the house down. And then Destiny says, why are you complaining about the mosquitoes, you pussy? It's like, no, I'm complaining about the mitigation strategy. It's stupid. It doesn't do anything. And even if it did, it's at the cost of the structure that we're living in, aka the house, aka the government. So yes, does the virus kill a certain amount of people? Yes, does it kill like 1/3% of the population? Sure, but again, at what cost are we going to fix that? Oh, well, I guess we'll have to trample on virtually everybody's civil liberty so that we can give them ineffective vaccines that may or may not kill exponentially more people than the virus ever will. And we're going to do that as well as set precedents that we won't be able to easily roll back, and also explode the debt and increase interest rates and inflation rates, which is exactly what we need right now with the unemployment situation the way it is right now. So fucking eat a dick. That is so wrong, bro. Come on.
Because I'm going to be living next to Hassan with Melina, okay? Me and Melina are going to be in fucking... I'm not going to say the city because apparently that's doxing. We're going to be living right next to Hassan, all right? We'll be some of the only people left alive. Maybe he'll let us go swim in his fucking pool that is reserved for his family, I guess, because he adopts a bunch of porn stars or whatever. That's where I'm going to be. And you're going to be in your shit-ass little fucking rinky-dink meth lab Midwest fucking home crying because your third family member died of the coronavirus. Okay, fuck you, dude. God, it's so stupid. Holy shit. I can't believe that it's 2021 and I have to fucking argue about vaccines. It's the dumbest fuck... It's so fucking stupid. It's the dumbest fucking thing in the universe. I actually can't believe it. Holy shit. I don't know how loud I can be. I obsess over an additional 5% damage resistance in a video game. How is 50% damage resistance in real life not worth it?
Okay, really? Oh, so you can get onto your third family member that has died from COVID? Dude, I'd probably pay you $10 if Destiny could show a family where 3 of them died from coronavirus exclusively. And a lot of smart people will say, well, you know, it isn't the corona, it's just the thing that started it, you know? It's like, well, shut the fuck up. They died of pneumonia on the ICU with the incubator, okay? They didn't die from the fucking virus. It's like saying, look at all these people that are dying from the flu. No, grandpa had type 2 diabetes, fucking prostate cancer, you know, an avid smoker, and was really fat, and he had the fucking flu. Oh, but it was the flu, bro. No, it wasn't. Shut the fuck up, dude. So disingenuous, bro. And, you know, anecdotally, yeah, well, this is what people say all the time. There's so many people dying from corona. My neighbor's friend's cousin died, or my 80-year-old grandmother's nephew died. Like, come on. Or, you know, I know somebody who died at the age of 22, bro. Yeah, and it's like, okay, how much did he weigh? Well, you know, sure, yeah, he did weigh like 350 pounds and did have diabetes and he did have all these other preconditions, but, you know, you have to, you know, project yourself. No, shut the fuck up, bro. No, it is. First of all, the virus isn't even as close to as bad as Destiny portrays it, number 1. And number 2, the vaccine is not as effective as he says it is. And 3, he fails to actually address the long-term effects. 4, he doesn't really address the government overreach and the problems that's going to have in the future. And 5 would be that he is completely disingenuous in his argumentation, and either he's stupid or he's trying to manipulate people. And I think it's it's an awkward combination of both, actually. 5, okay, and then 6, the way he argues it is completely condescending and very, it rubs people the wrong way. So he's just demagoguing to the people that support the vaccine. And number 7, again, if you got the vaccine, of course you're going to be carrying water for the vaccine because you don't want to feel like a mark, which is what you are. So it's the equivalent of saying, well, this Vietnam veteran says that Vietnam was justified. It's like, well, obviously he doesn't want to feel like an idiot, so of course he's going to say that it was justified. Or if you went up to a Bush cabinet official and you said, hey, was Iraq, was that a justifiable invasion? Of course they're going to say yes, because they don't want to feel dumb. Okay, so he has everything to lose health-wise because of this vaccine for no good reason, honestly. And so, yeah, complete L for Destiny insofar as I'm covering it. And I hope you guys enjoyed the video. I did some editing, or I did some tinkering to the OBS. I wonder if you guys like the difference of the quality. Just, it's a little different. So anyways, guys, I hope you appreciate that. Comment down below if you like this format of video. And I am out, guys. Thank you so much. Fiend finale. I'm done.